Hey everyone, how you all doing? Just thought I'd do this short video really because I had a mate who asked me recently what it was like to be admitted to a psychiatric ward. Well, I just thought there's got to be a lot of people out there who, you know, who have mental health issues and don't know what it's like to be admitted to a hospital. They've never been admitted to a hospital and they're probably really scared. So, the thought of going into hospital, or maybe they've been told they may have to go into hospital, and they just don't know what to expect. So I just thought I'd do this short video really to kind of give you an insight into my personal experience of what it was like to be admitted to a psychiatric hospital. So yeah, I got this question. I thought I'd better answer it, but first I'll give you some background. I was diagnosed with bipolar disorder type 1, which means I suffer with both depression and mania, which is full-blown mania, which is type 1 disorder. Type 2 disorder is a hypomania, which is less of a mania and doesn't always require hospital admittance, unlike bipolar 1 disorder, which when you're in a manic episode, you kind of have delusions and psychosis, which require hospitalization. So, yeah, I got admitted really because I was on a beach. I was totally delusional, I was psychotic, I was hallucinating, I was a harm to myself. I didn't know where I was or what I was doing, and everybody was kind of like scared. So the first thing that happened was my wife called the crisis team here in the UK. She basically said to them that, what was going on, and they decided that it would be beneficial if I went into hospital. So, I got taken to my local psychiatric ward here in Taunton. It's called Ryden House. And I must admit, I didn't really feel anything at the time. I wasn't scared, I wasn't anything, I was just totally manic, so I didn't really know what to expect when I got there. But my first impressions of the place when I did arrive was, it just looked like any other hospital ward really, except that it was locked. You went through a secured door, you got taken into the ward, it had a tea room where people ate their lunch and have their tea and stuff like that. There was a communal area where people did arts and crafts, and I basically got taken in. All my stuff got checked. It was a little tiny bit, degrading, but I guess they wanted to make sure that I didn't harm myself with whatever possessions I had. So they kind of looked through all my stuff and they took anything off me that could harm myself. I was in my own clothes, they didn't make me take my own clothes off. There was no strip searches. There was, nobody came at me with a needle and stuck a needle in me, to sedate me or anything. They kind of let my wife on the ward and my friend was there as well. And yeah, I got shown to my room, which was a single room. I didn't have to share with anybody. It was clean, it was tidy. I had a bed, a table, a chair, a shower unit and a toilet. And that was it. My wife said goodbye and, off she went. So I kind of was left to my own devices really. It was really strange. The routine in hospital was quite, relaxed. You got up at kind of like between 7 and 8:30 when it was medication time. You got given your medication that your doctor had prescribed you. You had breakfast. Then you was left to your own devices. You could do arts and crafts. You could play pool. You could watch TV. You could go outside to the smoking area or the garden to relax. For me, it was summertime, so it was nice and sunny. I spent most of my time outdoors. There was lots of other patients to talk to about my experience, so I guess I didn't have to go through it alone. I could talk to other people, and that was a good thing, because I think if you don't have someone to communicate with, you're isolated. and to be able to talk to other people with similar conditions to myself, it was great. It meant that I could get things off my chest, I could alleviate my fears, and and time would press on. It would be tea time. We would have our tea. It was it was a very structured place. Then in the evenings, again, it was just left to your own devices. I got to see a psychiatrist twice a week for about 10 or 15 minutes, that's all. But in the UK, the hospital really that you go to is what they call an acute ward. So it's there to treat a particular episode that you're having. It's not for long-term treatment. So I was suffering with mania. They were there to treat my mania. They treated my mania. They let me go home into the care of the community mental health team. So, a lot of people think that when you go onto these wards that there's going to be people there rocking backwards and forwards in chairs and, people dribbling at the mouth, people getting violent and all sorts of crazy shit going on. And it's not like that at all. It's just full of, normal people just trying to get by. And yes, some of these people really have varying degrees of mental health problems. You could be in hospital with other people with bipolar. You could be in a hospital with people with schizophrenia. There could be people with severe depression. There could be people with personality or borderline personality disorders. So, there's always going to be a mixture of people. But that's good, because with that mixture of people, you get an insight into how their mental health affects them. That asked the same question, did they give me electric shock treatment? Electric shock treatment is antiquated. You don't just get wheeled into a room and get zapped with 1,000 volts through your brain anymore. It's a treatment process that's done for a last resort for people with really severe depression that have tried to work through depression in so many different ways, and nothing else works for them. And they won't give it to you without your fullest consent. They can't even give it to you now with a court order. It has to be a consensual act. So don't be worrying about electric shock treatment. Those things don't happen. Nobody forces you to have medication. Nobody forces you, right? Unless you're severely, severely ill, and you'll be in the intensive care unit if you're that ill. So nobody's going to force you to do anything that you don't want to do. At least not at first. So how do you get, into a mental health unit or a psychiatric ward? Well, there is 3 ways you can get in there. There's a voluntary way, which is the way I went in, which is through the front door of my own accord. I wanted to go there, or I agreed to go there under my own steam. I was treated. I was in there for 11 days, and I was released, or discharged, as they like to call it. You can be sectioned under the Mental Health Act. There's 2 types of sectioning, Section 2 and Section 3. A Section 2 is for observation, and what Section 2 does is it allows them to keep you there for 28 days for observation so that they can assess you and see what's wrong and the best possible treatment. It doesn't mean you're going to be there for 28 days. It just means that they have 28 days under the law to observe you. And a Section 3 gives them up to 6 months. Now, what that's for is that's for a treatment program. Now, let's say they've observed you, they've diagnosed you, they've come up with a treatment plan, you're refusing all the treatment available to you, yet you're a danger to yourself, and you couldn't possibly be discharged. A Section 3 allows them the time they need to work through a treatment program with you, and that normally lasts up to 6 months. So there you have it. Life in hospital. It's not bad. Trust me, if you have to go there, don't be worried. Don't be scared. Pack a bag, pack plenty of clothes, pack some drawing materials, pack whatever you feel you need to get by. Make sure you take your cash point card because you're going to need some money. Make sure you got some cash on you. If you're a smoker, make sure you take some cigarettes with you, and you're good to go. Hope that's helpful. Please subscribe. The button's there. If you like my videos, press a like, leave a comment. I always get back. Cheers. Bye.